Okay, we're going to move right along here, and we're going to invite our third presenters to start. Our third presentation is going to be given by Dr. Anne-Marie Flores and Dr. Whitney Welch. Dr. Flores is the Director of Cancer Rehabilitation at the Cancer Survivorship Institute here at the Lurie Cancer Center. And Dr. Welch is a researcher and an assistant professor in the Department of Preventive Medicine at Northwestern's Feinberg School of Medicine. And what they're going to be talking about tonight is ways to recondition and recuperate following our many months of quarantine. So very excited to see your presentation tonight. Welcome, Dr. Welch and Dr. Flores.
Well, thank you so much for that introduction. We are presenting tonight on Reboot, Rehabilitation, and Reconditioning after quarantine. And we're going to go over cancer-related functional limitations, the need for rehab, and what it addresses. And I'm also going to touch a little bit on lymphedema because those questions always come up. And then Whitney's going to take it from there and talk about reconditioning after quarantine. And then I'll pick up with tips and resources for self-navigation. Oops, it's not letting me advance. Okay, there we go. All right, so we know that with cancer, its treatment can limit function. I mean, 100% of the patients that I've treated over my bazillion years as a physical therapist is everyone complains about a problem that they're having with fulfilling the stuff that they want to do physically and functionally. And this means that these limitations can spill over into participating in your life, like doing simple things, carrying, putting away groceries, showing love and affection with children, grandchildren, and friends and family. It can interfere with walking, driving, returning to work, doing household chores, and exercising and participating in stuff that you really like to do. So early detection of functional limitations is really key, and rehabilitation can definitely help with this. So what is cancer rehabilitation? It's a field, it's a subspecialty in rehabilitation, and it is comprised of individuals that specialize in the rehabilitation sciences and clinical practice. It's interdisciplinary with licensed and board certified physical therapists, occupational therapists, speech therapists, and physical medicine and rehabilitation physicians. And we work to basically give you back your physical and functional life and to help you better participate in your life to maximize that physical and functional ability beginning at any time you want. When you've had your diagnosis of cancer, we can intervene before you start treatment, during treatment, and after treatment. We help you recover function and return to fitness and your social roles. But what we all need to have is we need a referral from your oncologist or your primary care provider, your nurse practitioner, or your physician assistant. All of these individuals can refer you to rehabilitation services, and rehabilitation services is covered by insurance. And just a little fun fact to know is that the American Physical Therapy Association just turned 100 years old. So we've been covered by insurance for a very long time. So impairments that are treated by cancer rehabilitation that can then downstream turn into functional limitations can run the gamut across all of our different parts of our body and with different kinds of symptoms. So I've highlighted in yellow those that people are probably most familiar with, but as you can see, these highlighted impairments are a small part of the big list that we have that falls under our scope of practice among rehabilitation specialists. We know also that in addition to knowing these impairments exist, the American Society of Clinical Oncology, the National Cancer Center Network, and the American College of Surgeons all have published guidelines that have included references to and advocated referral to rehabilitation specialties for a variety of disease types and physical and functional sequelae that happen due to your cancer and or your cancer treatment. However, one of the issues that we have to deal with on the rehabilitation side is we have to figure out the timing for rehabilitation. I am all about the earlier the better, and as often as possible, beginning at diagnosis all the way through end of life, rehabilitation can play a role. So I've worked with a lot of patients that I've helped them learn how to advocate for themselves for rehabilitation. And in my entire career of a bazillion years, I don't think I've ever had one survivor of cancer that has asked for a rehab referral that was denied that. Every patient that I've had has had a referring provider say, "Oh, of course, why not?" So definitely ask, and hopefully you will receive. So I did say I wanted to touch a little bit on special considerations for lymphedema. Please know that lymphedema does not happen only for patients who've had breast cancer. It's just we probably know a little more about it in patients who have had breast cancer because there's been a lot of research done on it. However, lymphedema is caused by lymphatic damage or loss, period. Some people are born with these issues, but other people acquire it from either the cancer itself or cancer treatment. But please know that exercise is indicated for people with lymphedema. And it's important that if you think you have lymphedema, is to ask your doctor about it, ask your rehabilitation professional about it, and get a clear diagnosis of it and treatment of it. And once you've been able to have it treated, get clearance from the doctor and your certified lymphedema therapist, and most of those individuals are physical therapists and occupational therapists. Get clearance from your doctor and your rehab person, and then start slow and slowly build up the time and resistance. And Whitney's going to talk about that also. Please also know that exercise can reduce the exacerbations of lymphedema. That is, it can help prevent it from getting worse, and it improves quality of life. A ton of literature shows that, and it supports that. So there's no reason not to exercise. But we also recommend that with exercise and with everything else that you do in your life, if you have lymphedema, is to adhere to risk reduction practices. And these are minimize symptoms, take impeccable care of your skin, work to keep the swelling down, and stay healthy. So minimizing symptoms means you really want to maintain a constant temperature at home. You don't want to have it too hot or too cold. Stay away from saunas and hot showers, at least not immersing the affected area in this kind of heat. Follow exercise guidelines, but progress slowly, and use your prescribed compression garment. Avoid blood pressure cuff being taken, your blood pressure being taken in the affected side, and try to avoid needle sticks in the affected areas. Proper skincare, like I said, impeccable skincare. Use insect repellents. Wear sunscreen. These are all things we should be doing anyway. So be, like I said, again, reminder, impeccable skincare. Keep the swelling down. Your swelling's probably going to get worse at the end of the day. Elevate that body part as much as you can. And then engage in your self-management, wear prescribed compression bandaging or garments, and you would learn about all of that with your certified lymphedema therapist. Wear well-fitting clothes and stay healthy. Keep your hands washed, eat a well-balanced diet, and watch for signs of infection, and exercise. So take it away, Whitney.
Yeah, that's the perfect transition. So I'm going to be talking about how do we recondition after this 16 months of quarantine. And so if you want to go ahead and advance the slide. we're going to talk about how do we reboot our exercise programs. So Tim mentioned this earlier, so thank you for introducing it. And I'll just reiterate the American College of Sports Medicine joint guidelines with the American Cancer Society came out with these guidelines in 2019, and they are extremely broad. We're looking at 3 times a week for 30 minutes each session of moderate aerobic exercise. So that can mean a ton of different things. So we're going to, on the next slide, we're going to get into how we can operationalize these guidelines. The second part of this guideline is also looking at resistance training. So we know that resistance training can be good for increasing our lean mass, increasing our strength, increasing our ability to engage in activities of daily living. So that guideline is looking at 2 times per week, 2 sets of each activity that you do, 8 to 15 reps. Overall, the main takeaway, you don't have to remember any of these numbers, any of the amount of time per day or per week, but overall, we just are trying to avoid inactivity, and that's the biggest takeaway. And so these guidelines, it's just important to note, were mainly based on evidence looking at reducing cancer-related fatigue, increasing health-related quality of life, physical functioning, reducing anxiety and depression. And so that's where these guidelines came from. I can go. Yeah. So the way that we, as exercise physiologists, prescribe an exercise plan is by fitting it into these 4 factors. So we call this the FIT principle. And the FIT stands for the frequency of the exercise, the intensity of the exercise, the time that that exercise is going to take, and what type of exercise you're doing. So if we overlay our guidelines onto the FIT principle, this is what it would look like. We have the left column looking at, we have 3 times per week. So that would be how frequent we do the exercise. It's going to be at a moderate intensity. And there's a number of ways that we can measure that. So a very specific way would be to look at your heart rate. If you have a heart rate monitor, if you have like a smartwatch that can tell you your heart rate. But an easier way to do this is look through something called the talk test. So if you find yourself working at a pace or at an intensity where you can talk to someone, then maybe you're working at a pretty low intensity. But if you're working at a pace that you aren't able to engage in a very comfortable conversation anymore, then you're seeing that you're getting more into that moderate and vigorous intensity range. Once you're not able to talk to someone anymore, then you're definitely in that higher intensity vigorous range. How long do you want your exercise session to last? The recommendations recommend about 30 minutes total. And then what type? So the easiest one that we always refer to ends up being walking, because that's the one most commonly, people most commonly report engaging in. But as Tim mentioned, you can do anything. So thinking about the activities that you actually enjoy. So something like kickboxing or yoga, even thinking, sometimes we like to take a step back and think outside of exercise, but think of things that are just maybe a physical activity. So things that you do around the house. I know cleaning isn't the most exciting thing to be able to do, but that is an activity. So you can think of when you're vacuuming, you are actually engaging in activity, and you can likely count that as some sort of physical activity or exercise that you are doing. But the biggest takeaway here is you do want to focus on yourself. What are you comfortable doing? Where are you comfortable starting? And then you can progress from there. One important thing to note, when you do progress, you want to progress 1 factor at a time. So you're not wanting to take the frequency and the intensity and the time and increase them all, on your 2nd week or your 3rd week, but just start with 1. Maybe if you are doing 2 times a week, then progress to 3 times a week before you progress the time that you're engaging in the activity. So just a couple considerations I wanted to add in. Don't forget to warm up and cool down. It's an easy thing to forget, because if we are stretched for time, which many of us are, it's easy to say, well, I want to get my exercise in, and I don't have time for the warm up, I don't have time to cool down or stretch. But those are very important parts of keeping the exercise program safe. Find a comfortable activity or location. So pre-COVID, it was easy to say, go to all these different gyms that are popping up, different yoga studios, a community health center, but now maybe you're not so comfortable going to these places quite yet. So think of outside the box. And is there anything outside? And we'll also provide some great kind of online resources that you can use too out of your home. Set realistic expectations and goals. You can set SMART goals, which you're going to specify what your goal is, be very specific, make it measurable, make sure it's actually attainable and realistic, and then put a time limit on it. Also, don't be discouraged to reevaluate. So if you set this goal and then you realize a couple weeks into it that maybe it's not as realistic as you thought, maybe you need to take a couple steps back. Don't be discouraged to actually take that step back and make a goal that is more aligned with where you are at that time. Also enjoy it. Make sure it's something you enjoy, because the best exercise is something that you're going to keep doing. And so it doesn't matter if someone's running a marathon, the best exercise for you is something that you're going to do day after day. So things that people enjoy, you can find a buddy, but you can also incorporate phone calls or even friends that live in other states. One of the great things I think this turning into a virtual world has done is showed us that we can actually do things virtually with people in other places. So incorporate that into your workout. And then finally, be patient, because this all takes time. And that is one unfortunate thing about exercise, is we all want immediate results, but these things take weeks, months, and years. So, I don't know if you want to jump back in, Anne Marie.
Yeah, should I talk about the tips now?
Yeah, go ahead.
Okay, all right. So one of the things that Whitney and I talked about was, how do we, advise about how you decide to go to cancer rehabilitation or a fitness program. And so the basic question that's been posed by leaders in exercise science on this is to ask patients, are you safe exercising without medical supervision? If yes, go on with your exercise and work with someone that is a specialist in exercise, like an exercise physiologist, or a personal trainer that has more training in how to work with people who have cancer or have had cancer. And if you don't feel safe exercising without medical supervision, then ask your oncologist or your primary care provider for a referral to physical therapy or to occupational therapy or to speech therapy or whatever therapy you think you need. And then once you've achieved your goals in rehabilitation, then you can ask the rehabilitation specialist or your physician for a referral to a community fitness program or to another community fitness specialist. So these work together. It's kind of like the handing off of the baton during a team race. So I can show during the Q&A period a couple of stretches that are really easy to do. Just sitting here, we're all pretty stiff from a lot of the sitting people have done during the pandemic. You want to talk with your doctors to let her or him know that you are going to resume exercise, ask for that referral, and when cleared by your doctor and or your PT, return to fitness and go with the reconditioning, like in the fashion that Whitney laid out. Some resources for self-navigation. NM rehab services are available throughout Chicagoland. Here is just a clip of some of the resources that are available. The entire list of specialty treatment and locations for Northwestern medicine is available in the resource area. There are other non-NM clinics available too. If you have a referral for rehabilitation or for community fitness, you get to choose where to go. Your provider doesn't necessarily get to choose. They can advise on what they might recommend, but ultimately you get to decide where to go. There are tons of resources that are available online to find a lymphedema therapist. And you want to find someone who is at least a certified lymphedema therapist like me, And someone, there are additional qualifications, someone that has Lymphology Association of North America certification is also an additional thing to be looking for. And then I think also available in the resources area is the list of community and online fitness programs that Whitney has curated for our group tonight. And that's it. I'm going to go ahead and stop sharing my screen. I want to thank everyone. Let me stop sharing and then take any questions we might have.
Thank you, Dr. Flores and Dr. Welch. I actually have a few questions, but I want to make sure we give enough time for you to go ahead and show us those stretches as well. Actually, I think this question might refer to our system, but I'll let you interpret it. They just are asking if a cancer rehabilitation program is available in most cancer centers, or is it specific to Northwestern?
Cancer rehabilitation programs are available in a variety of places, and even in places where it doesn't have it branded as cancer rehabilitation. If you have a team of individuals that have experience with cancer patients and have cultivated their clinic to treating these patients, that is a program, if you will, of cancer rehabilitation. But when I think of programming, I think of clinical services, research, and community outreach. So I think it all depends on what you're looking for there. I hope that answers the question.
I also want to, I know that I think you covered this, but I think it bears repeating, is how does a patient know when it's not okay to exercise and when rest is probably what they should be getting rather than pushing themselves?
Whitney, do you want to take that?
You can go ahead if you'd like. Yeah.
Okay. Well, I was just going to talk about the Borg scale, and I thought an exercise physiologist should probably talk about that a little more.
Yeah, sure. So, okay, could you repeat the question? So, when you should rest instead of exercise? Yeah, so, I mean, first you should, if you have any concerns whatsoever, talk to your provider to be sure that you are, if you're not feeling healthy enough to exercise, make sure that you don't have any contraindications. And those typically are more things that would be cardiovascular, metabolic related. But if in terms of, I know Anne-Marie was mentioning the Borg scale, so that's looking at a feeling scale on how, I guess, comfortable you feel in an exercise. So if you're walking and it's feeling extremely hard, then that's probably an indication that maybe you need to take a break, let your body rest and recuperate so that you are able to engage in the activity in a safe manner.
Yeah, thank you. That's great. One of the things that I do with, or have done with patients, is help them figure out what their goal of exercise is going to be and to help build up toward that and really kind of break it down into smaller chunks. So for example, if you're feeling tired because let's say you walked 2 miles on one day and that just really took the stuffing out of you, then let's back that up, give you enough time to rest, and choose a different goal of perhaps maybe going a 1/4 mile, or you know, your Mount Everest might be making it from your front door to your mailbox, and then slowly build up from there. One of the things that I do with patients is have them build up by, you know, very slowly, and to, you know, really be mindful of the entire body experience, but to add perhaps a minute a day of exercise. And the guideline that Whitney went over, particularly with FIT, will really help you figure out which things to adjust first. The other thing too is that you need to be mindful of when the fatigue is incapacitating and being careful that it might that it's not something that's a little more serious. You know, like Whitney talked about things that might be cardiovascular in nature. If you're in the middle of your treatment, you know, you want to be keep on top of what your lab values are, so you know perhaps you might be a little immunocompromised. Maybe that's part of what's going on, and just be consulting with your medical team. I hope that helps.
That was great. Thanks, Dr. Flores and Dr. Welch, for your presentation, and have a good evening. We appreciate you being with us tonight.
Sure. Thank you.